Hi everyone, this is Dr. Tamra of Inner Dynamics Physical Therapy. I'm a pelvic floor physical therapist and I'm also 6 months pregnant. And I'm sharing some of my favorite exercises I've been doing throughout pregnancy to stay nice and strong, to have a successful delivery, and to be nice and strong after delivery. So this is my leg series. This is not just for people who are pregnant. This is a very similar activity that I would do prior to pregnancy. I've just modified it slightly and shortened it because I don't have as much energy now that I'm pregnant and growing a human being inside of me. Legs are super important during pregnancy. Like I said, now I'm about 25 weeks. I've had no pelvic girdle pain yet, no low back pain, glute pain. I do this about once a week and it really keeps that whole system really stable and strong. And if you are able to do it, I highly recommend it. Again, I can't see you, I can't see your body, I don't know your limitations. So please consult with a physical therapist or a doctor to see if these exercises are right with you. If you are generally healthy and you were working out prior to pregnancy, I think this would be a great workout for you just to be consistent throughout your pregnancy. If anything hurts, don't be stupid, stop, and go get an expert's opinion. I hope you enjoy this lower leg series. For this lower leg workout, you just need a step of whatever height you think is suitable for you. For some people, this might be a lot lower than what I'm using, especially if you've never done this workout before. Could be a table, could just be a step at your house. And then I also want you to get some weights. Now, for some of you just starting this workout, you might do all of these exercises without weight for your first time. If you're generally in good shape, you might want some weights. I have some 10-pound dumbbells with me. Prior to pregnancy, I was doing this same workout with about 20-pound dumbbells on each side. So I've now cut my weights in half, but I also have an extra 25 pounds inside of me. So I think that's fine. So the first one we're going to do are step-ups. Step-ups are the number one exercise you can do for your glutes. So we're going to come up here and we are going to step up. If you can, work on your balance. We're going to do 10 step-ups on each side. If you have to, you can toe tap down, but if you're feeling good, just keep stepping up on that one leg, really feeling it in that right glute. I also want to make sure that my knee is not caving in. You want to keep your knee pointed straight out in front of you. Definitely feeling the burn. We got one more. Excellent. And not plopping down, slow and controlled. Other side. I always start with step-ups because they're my least favorite and then they get over with soon. And we're going to do 10 on the other side. Trying to stay as nice and balanced as possible. Just be aware that when you're pregnant, you're going to get out of breath much more quickly than you did prior to. Make sure you take a little extra time to recover. We got 2 more. Awesome. So usually I go straight through prior to pregnancy. Now that I'm pregnant, I sit in between. Also a great thing with the box. Just sit, chill, give yourself a high five for deciding to do this today. You're probably growing hair, fingers, toes, and you're also working your glutes. That's amazing. You all are super women. I'm very proud of you. So now we're going to do side step-ups next. This takes into consideration another glute muscle on the side of our pelvis. Super important for pregnancy, also super important for anyone who's not pregnant doing this workout because it's a great stabilizer of the pelvis. The more we strengthen that glute med, the more stable we stay and the less likely that anything is going to go wrong. So this is a curtsy side step up. If what I'm about to do is too hard for you, you can also just start with a regular side step up, which would look like this, okay? I'm doing the more advanced version. I'm feeling good today, so I'm doing a curtsy. So my outside leg is up, okay? Now, I'm not just gonna throw myself up there. I'm gonna use that side of the hip, and I'm going to really feel that engage, come up, and I'm really just doing a toe tap, and then I come down nice and controlled, and I land more lateral, not back here. I'm trying to land more to the side. We're working on the sides of our pelvis, our sides of our glutes. So we are going to do 10 of these. And you should really feel that burn in the side of your glute. You're doing fabulous. We're almost done. Feeling that burn. Again, great blood flow to the pelvis. Great support. We got, I think, one more. Pregnancy brain. Good. Other side. So you're going to see my back side for this. So outside leg if you're feeling good. Up. And let's just knock out these 10 so we can sit on our box and take a break. You can see I'm trying to go nice and controlled up. Up with power, down with control, landing more lateral, killing it. I think we have 2 more. Hopefully you can count better than me. Whew, okay. Let's take our nice break. We're halfway done. That's awesome. Next thing we're going to do are split squats off the box. If these are too difficult for you, you can also just get into a lunge position and do that instead. Again, I'm doing the more advanced version of these exercises. Split squat, when we do them, we can affect different muscles depending on our body position. So if you want more quad, I want you to be more upright. If you want more glute, I want you to be bent slightly. So I'll show you that after I catch my breath and I get into position. Okay, split squats, and then we are done. We are close. Let's grab our weights. This is a harder exercise, so if you were going to ditch the weight for one exercise, this would be one I would pick. I'm going to try to show off for you and do it with the weight. So we're going to put our back leg up on the box, nice and rested. You might have to hop forward a little bit to get into good position. And then from here, I'm just doing 10 reps. So again, if I stay upright and go like this, that's more quad. So I'll do 5 like that. And then if you want more glute, I'll show you forward lean, almost like you're looking into a pool down below you. Woo, feel this more. And that's more glute. Great. So now we just switch our feet. And we are so close, and we're going to do the other side. So I'm going to just do more glute on this side because I need it. My quads are fine. So I'm going to take that more forward bend. And I'm going to feel that light up my glute. And this baby has no idea all the trouble it's giving me right now and how much harder it makes workouts. You guys are doing great. We got 2 more. Excellent. Let's go take another break. Gather our thoughts or get rid of our thoughts. We got 1 more exercise. It's the easiest exercise, which is great. We're kind of winding down. If you're feeling like a rock star today, do this last exercise and then go through again for a second round. I try to do 2 rounds of this about once a week. Some days it's easy. Some days I can barely get through the 4 exercises. You got to see how you feel on certain days. Certain days your energy might be depleted. This is not the time to push yourself. You can't fight against this pregnancy. I have learned that very personally. So do what you can, but make sure you have enough energy for yourself and for the next day ahead. So now we're going to squat, and you can do this many different ways. I want to do a nice goblet squat with my legs a little bit wider because I'm feeling good. For some of you, you might have started to have some of those aches and pains around the pelvic girdle. You might want to put your legs more underneath your shoulders so they're not as wide and not as much pressure. But I'm feeling good, so I'm gonna go a little bit wider today, so I get into some of that lateral part of my glutes. And weights, you can hold them like this, or like this, whatever's comfortable for you. And then we're just going to squat down and back up. If you don't know if you're squatting correctly, the best thing to do is just go sit down on your box like this, because then you know your hips are going back enough. So maybe you start the workout doing a few of those. Once you feel comfortable, air squat it out. At this point, I've stopped counting. We're over 10. Let's get to 15 because we can, because we're super women, because we're here. We did it and we're almost done. And last one, you can do it. Great. So you finished your leg workout for pregnancy. Hope you enjoyed it. Again, you can do a second round of this, or one round is great. Keep doing this throughout your pregnancy. It'll keep everything nice and strong. Hope to see you next time.